Do your legs swell? What is causing your legs swelling? There are multiple causes that can cause leg swelling, such as physiologic and pathologic. So let's take a deep dive. Guys, if you like this video, please don't forget to subscribe and like. This helps me build my channel. So physiologically, we have these valves in our veins that are one-way gates that help facilitate the passage of blood from our feet back to the heart, where they can go through the lungs for normal oxygen exchange. What happens though over time is that these valves can become leaky from disease, from inflammation, from stress, from weight, from sedentary activity, and ultimately can lead to more and more swelling. I've even seen some people, based on their occupations, develop leg swelling just because they're standing on their feet all day. Think of your surgeons and your nurses. There are quite a few doctors that will also wear compression hose and stockings. Other causes that can also lead to a fluid buildup include pregnancy, inflammation, stress, trauma, surgery, like a lymph node was removed, for surgery for cancer. And that can also lead to swelling. There are some medications that have also been linked to swelling. There is a blood pressure medication called amlodipine. And this one has a side effect of lower extremity swelling. If the swelling becomes severe, I tend to stop this medication. A few individuals on NSAIDs, which are anti-inflammatory, such as ibuprofen, Aleve, and birth control pills, have also reported leg swelling. In a future video, I'm going to talk about how to treat swelling, which is very simple. However, if the cause is not a disease, then usually some lifestyle changes and behavioral changes can actually alleviate the swelling. If it's a medication that's causing the swelling, it's best for that medication to stop, if it's even possible to stop it. When I see leg swelling in the hospital, I am thinking of diseases because as a doctor, that's what we're going to think about. And there's 3 organs to think about, such as the heart. Is there heart failure? Is the heart struggling to pump blood effectively? When the heart fails to pump blood effectively, the blood actually pulls backwards and can collect in the legs commonly, but in less common places in the abdomen. And when there's too much fluid buildup, it can develop in the lungs and cause heart failure. Number 2, liver disease. Over time, with chronic liver disease and end-stage liver disease such as cirrhosis, there can be a problem with fluid regulation, and fluid just continues to accumulate in places like the abdomen, the legs, and in other parts of the body. And then finally, the kidneys. The kidneys are those organs that are responsible for filtering excess fluid in addition to toxins. That excess fluid comes out in the form of urine. And when the kidneys begin to shut down, which is a silent process, then the fluid is not exiting the body, it's just accumulating within the body. So any of those things can cause pathologic causes or disease of edema. Now, I feel I have to mention this because there's quite a few videos out there about our president's diseases. And I'll tell you that I see edema or lower extremity swelling in many people. It does not necessarily mean that they are developing heart failure or need to go on dialysis. That is extreme. That is not the case. I've seen people live with edema for years to decades. So there is no way to conclude by looking at a picture of swollen legs that there's a lifespan of less than 6 months to a year. If you like this content, please subscribe. It helps me build my channel. I am here to make medicine make sense. Until next time.